Hi, my name is Trinh. I am a hygienist for over 30 years, and I'm really passionate about really being able to offer really what we call bread and butter situations, which is dental fillings. Whether it's a chipped tooth, a decayed tooth, a tooth that's been worked on that is now failing. Dental fillings at our office is one of our cornerstones in making sure that that's the first step in making sure that the patient stays healthy for a long period of time. Dental fillings are necessary when there is a break in the enamel. We use high quality definition x-rays on top of AI. So we really are able to really pinpoint when that occurs at the very earliest stage. So when we use our AI software, that allows us to detect something 7 times earlier than with just a plain x-ray with our naked human eye. So it's really incredible to be able to see that break in that enamel. And as soon as we see that break, that's when a dental filling is warranted. The type of filling material that we use are quite different, depending on the size of the break or the hole or the cavity. It could be a full resin material down to something a little bit more high strength. So depending on the size of the dental work, where it is, and the access to it, we have a variety of dental material, all non-metal materials that allow us to be able to craft the tooth and really reconstruct the tooth as a whole so that there's no longer a break in the tooth. The process of getting a filling at our office is really starts from the very beginning, making sure that you're comfortable. That's a pillar of our mission statement is your comfort is our top priority. So getting you nice and comfortable, all doctors and our team members take pride in making sure that the anesthetic part of that procedure is top notch and making sure that we take our time before we even start with you. But once we get started, it's a very meticulous step. We do multi-level layers. We take a lot of photography and AI to make sure that that decay is completely removed before we slowly rebuild that tooth to where it's basically reforming the tooth as if the cavity was never there. So it's almost like artwork, and it's really impressive to show our patients the before, the during, and the after, because it really allows them to see how much tooth structure they started with, how much tooth they were missing after the cavities were removed, and how we rebuild it so that they can really be able to kind of take ownership of, wow, like if I didn't get started with this before, or if I get it again, this is what could happen once a cavity gets going in my tooth. So it's really incredible. We use that at any opportunity to do an educational spot for our patients to make sure that they understand these steps are possible, but these steps can be prevented with prevention down the road as well. Fillings typically last, I would say, anywhere from 5 to 10 years or even longer. It just really depends on the actual filling material, how it was placed, and also how it's cared for. So obviously we use the highest quality materials. All our doctors are PANKI trained. They're meticulous when it comes to actually doing the actual restorative work. But the key is basically home care and professional care. That's really important for a patient to understand that once that filling is completed, it's an ongoing lifetime maintenance in order to make sure that that filling lasts as long as it could, and that we don't have recurrent decay. Me, myself, as a child, used to think once you have a filling, that's it, your tooth is like invincible. And that's just not the case. And a lot of people really still feel that way, is that it was treated, I don't have to treat it again, or I don't have to do anything to it because I'm good. But it's not necessarily the case. Your tooth is a living, breathing thing in a living, breathing organ. So it's really important to make sure that the maintenance and the proper home care and the proper diet will help that filling last a whole lot longer. Patients are really surprised how quick a filling could be done and how comfortable, really. I feel like a lot of times they're so comfortable, they doze off. We have noise canceling headphones, so they're just listening to their type of music that they want. So by the time they're getting set up and shown the before, after, and during photos, they couldn't believe that all that dental work was done during the time that they're relaxing, or that it was quick because they're not thinking about the noise, the pain, and the discomfort because they're so comfortable. If someone is overdue or they suspect they have a cavity, the first thing is to make that phone call and get that checked. I always tell patients, the not knowing, the longer you not know, the worse it's going to get. So I tell people a cavity is like a chip on your windshield. What I know is that chip will spread. Will it spread in a couple of hours, a couple of days, a couple of months? It all depends, but all I know is once that chip occurs, it will split. So same thing with a cavity. Once there's a break in your enamel, the longer you wait to treat it or have it checked and get it restored, it will continue to get worse. And unfortunately, it's really hard to tell how quick or how fast until as soon as you see that break, that's when the treatment should be done. So that's one of my biggest advices for most of my patients.